Graphic analysis of cardiac cycle. What is electrocardiograph or ECG? It refers to the recording of the electrical activity of the heart. It shows P, Q, R, S, and T waves. These are electrical voltages generated by the heart and recorded by the electrocardiogram from the surface of the body. This is the normal electrocardiograph, shows waves and intervals. It will be discussed in its chapter more deeply. The P wave, which is generated by atrial depolarization and causes atrial contraction. The QRS waves, which are generated by ventricular depolarization and causes ventricular contraction. And the T wave, which is generated by ventricular repolarization and causes ventricular relaxation. Pressure changes in the atria. There are three minor pressure elevations called A, C, and V atrial pressure waves. These are the A wave, C wave, and V wave. The A wave is generated by atrial contraction. The C wave is generated by slight backflow of blood into the atria at the onset of ventricular contraction. And the V wave is generated by slow flow of blood into the atria from the veins. Graphic analysis of ventricular pumping. Keep in mind that the horizontal line shows volume and the vertical line shows pressure. The blue curve shows diastolic pressure and the green curve shows systolic pressure. Until the volume of the non-contracting ventricle rises above about 150 milliliter, the diastolic pressure does not increase much. Therefore, up to this volume, blood can flow easily into the ventricle from the atrium. Above 150 milliliter, the ventricular diastolic pressure increases rapidly, partly because of fibrous tissue in the heart that will stretch no more, and partly because the pericardium that surrounds the heart becomes filled nearly to its limit. During ventricular contraction, the systolic pressure increases, even at low ventricular volumes, and reaches maximum at a ventricular volume of 150 to 170 milliliter. Then, as the volume increases further, the systolic pressure actually decreases. This occurs because at these great volumes, the actin and myosin filaments of the cardiac muscle fibers are pulled apart far enough that the strength of each cardiac fiber contraction becomes less than optimal. Note especially in the figure that the maximum systolic pressure for the normal left ventricle is between 250 and 300 millimeter of mercury. But this varies widely with each person's heart strength and degree of heart stimulation by cardiac nerves. For the normal right ventricle, the maximum systolic pressure is between 60 and 80 millimeter of mercury. Now let's discuss about the volume pressure diagram during the cardiac cycle in four phases. Phase 1, which is period of filling. It begins at a ventricular volume of about 50 milliliter and a diastolic pressure of 2 to 3 millimeter of mercury. As venous blood flows into the ventricle from the left atrium, the ventricular volume normally increases to about 120 milliliter and the diastolic pressure rising to about 5 to 7 millimeter of mercury. Phase 2, which is period of isovolumic contraction. During isovolumic contraction, the volume of the ventricle does not change because all valves are closed. However, the pressure inside the ventricle increases to equal the pressure in the aorta at a pressure value of about 80 millimeter of mercury. Phase 3, which is period of ejection. During ejection, the systolic pressure rises even higher because of still more contraction of the ventricle. At the same time, the volume of the ventricle decreases because the aortic valve has now opened and blood flow out of the ventricle into the aorta. Phase 4, which is period of isovolumic relaxation. At the end of the period of ejection, the aortic valve closes and the ventricular pressure falls back to the diastolic pressure level. The area subtended by this functional volume pressure diagram, it means the shaded area labeled EW represents the net external work output of the ventricle during its contraction cycle. In experimental studies of cardiac contraction, this diagram is used for calculating cardiac work output. When the heart pumps large quantities of blood, the area of the work diagram becomes much larger. That is, it extends far to the right because the ventricle fills with more blood during diastole. It rises much higher because the ventricle contracts with greater pressure, and it usually extends further to the left because the ventricle contracts to a smaller volume, especially if the ventricle is stimulated to increased activity by the sympathetic nervous system. Aortic pressure curve. This curve shows aortic pressure. When the left ventricle contracts, the ventricular pressure increases rapidly until the aortic valve opens. The entry of blood into the arteries during systole causes the walls of these arteries to stretch and the pressure to increase to about 120 mm of mercury. Next, at the end of systole, after the left ventricle stops ejecting blood and the aortic valve closes, the elastic walls of the arteries maintain a high pressure in the arteries, even during diastole. An incisura occurs in the aortic pressure curve when the aortic valve closes. This is caused by a short period of backward flow of blood immediately before closure of the valve, followed by the sudden cessation of backflow. After the aortic valve closes, pressure in the aorta decreases slowly throughout diastole because the blood stored in the distended elastic arteries flows continually through the peripheral vessels back to the veins. Before the ventricle contracts again, the aortic pressure usually has fallen to about 80 mm of mercury. The pressure curves in the right ventricle and pulmonary artery are similar to those in the aorta, except that the pressure are only about 1/6 as great as diastole. The degree of tension on the cardiac muscle when it begins to contract is called preload. The load against which the muscle exerts its contractile force is called afterload. For cardiac contraction, the preload is usually considered to be the end diastolic pressure when the ventricle has become filled. The afterload of the ventricle is the pressure in the aorta leading from the ventricle. Sometimes the afterload is loosely considered to be the resistance in the circulation rather than the pressure. Normal heart sound. The opening of the valves makes no noise because this is a relatively slow process. However, when the valves close, the veins of the valves and the surrounding fluids vibrate under the influence of sudden pressure changes, giving off sound that travels in all directions through the chest. The closure of the AV valves or mitral and tricuspid valves produce low pitch and long-lasting sound, which is called first heart sound or S1. The closure of semilunar valves or aortic and pulmonary valves produce high pitch and short sounds, which is called second heart sound or S2. Now, let's listen to the S1 and S2 sounds, which is lap and dap. Thank you for staying until the end. I will see you in the next video.